Is there a way to actually measure pain? You may be very well familiar with the scale from 0 to 10. Do you have pain? 0 meaning no pain whatsoever, and 10 meaning the worst pain imaginable. It's a subjective scale and it's intended that way. Pain is an experience that's personal, and there's also a lot of factors that go into it. I recently had a patient who went back to her orthopedist after suffering from an ankle fracture, avulsion fracture, meaning that a piece of the bone popped off, and a bad ankle sprain. And the orthopedist then decided to poke and prod her and say, well, is this painful? Is this painful? Is this painful? First off, 6 to 8 weeks is the typical timeline for a simple fracture to heal, and I have been treating her well outside that timeline. So she may still have sensitivity to that area, but for an orthopedist to just simply poke and prod and say, well, does this hurt? Does this hurt? Does this hurt? Doesn't necessarily lend itself to something that's objective. The patient asks, how long should I continue physical therapy? The orthopedist's response for going to physical therapy, one, until there's no further progress made, which I agree with, and two, until you don't have pain anymore, which I don't 100% agree with, at least in that context. So, what would I use in order to decide how much pain a person is experiencing and try to make it objective as opposed to pushing and poking and prodding and saying, well, does that hurt? So, this is called a pain pressure threshold gauge. And what it does, it has a dial where if I apply pressure, it shows into pounds or kilograms of pressure, which then I could ask the patient objectively, at what point do you feel pain? And then I could associate it, oh, okay, so at 10 pounds of pressure, you feel pain. And I will do that as an initial evaluation to see as a baseline what they might feel. And as time goes on, as therapy and rehab goes on, retest, tell me when you feel pain. Oh, now I feel pain at 15 or 20 pounds of pressure. That is a better objective measure to decide what the tissues might be feeling along with the patient and what they feel too, as opposed to just poking and prodding and saying, does this hurt? Does this hurt? Does this hurt? I do see and treat patients a lot for pain, and that's one of the number one reasons why people come to see a physical therapist. But just to say that you should have no pain with anything doesn't necessarily indicate whether you should or should not continue therapy. Pain also typically subsides way before function returns. So if you still feel pain, and I could certainly elicit pain by poking and pushing or taking a pin and pushing it in and creating pain, that doesn't necessarily mean that the structures are hurt or that there is actual tissue damage. Pain is an output. So if I can elicit pain by adding enough stimulus, the patient will probably say, that hurts. And that is actually a good thing. Pain is for survival. If you had a knife in your hand, you should probably know about it and address that. So, yes, the scale of pain is subjective, 0 to 10. What are you feeling? But at least we could objectively measure what your pain pressure threshold may be as it relates to your injury, and where in the timeline that might be appropriate, where it's more aggravated and irritated versus time has passed and the tissues should be responding and adapting well, and now we could objectively measure it. Because if you're not assessing, you're guessing.